Has someone you love started showing subtle yet concerning changes over the past year? Many people tend to think of death in old age as something that happens suddenly, without warning. But in reality, the body often sends quiet, yet powerful signals months, even up to a year, before life reaches its final stage. The problem is these early signs are typically easy to dismiss at first. They seem so small, so insignificant, that they often go unnoticed. It is only later, with hindsight, that families recognize the clues that were always there. But by then, it may be too late to prepare in a meaningful way. Too late to make those final moments count, to gather those last precious memories. In this video, we're going to discuss 5 significant signs that often appear in the year leading up to the end of life. Some of these changes may already be things you've noticed in your loved one, but have brushed off as part of the normal aging process. Others might be subtle, but important shifts in health that could indicate the body's slow and steady decline. Recognizing these signs early provides you with an invaluable opportunity to give better care, make precious memories, and most importantly, ensure that your loved one's final stage of life is as peaceful, dignified, and comfortable as possible. Stay with us until the end of the video, because understanding these 5 signs can help you prepare emotionally and practically for what lies ahead. Recognizing these changes will not only help you avoid being caught off guard, but it will also help you make the most of the remaining time you have with your loved one. Let's dive in. 1. Significant weight loss. One of the most noticeable and often alarming signs that a person may be approaching the end of their life is unexplained weight loss. Initially, it might seem like a minor change. Perhaps your loved one's clothes are fitting looser, or they mention that their belt needs tightening. Maybe their once strong appetite has started to fade, or they seem to have less energy and interest in food. It might seem like normal aging, but in reality, significant and unintentional weight loss is often one of the first signals that the body is starting to shut down. When someone is losing weight without trying, it usually means that the body is no longer absorbing nutrients properly. This could be due to the body's inability to process protein, leading to muscle mass loss and overall weakness. As muscle mass decreases, it makes movement more difficult and increases the risk of falls. Muscle deterioration can also make the person more vulnerable to infections as the immune system becomes weaker. In addition, many elderly people experience a diminished sense of taste and smell, which can make food seem less appealing. Meals that once brought comfort may no longer seem enjoyable. This is not just a preference. This is the body's natural way of signaling that it is winding down. When the body realizes that it is slowing down, it reduces its hunger signals. This can result in skipped meals, smaller portions, and a steady loss of strength. As a result, an elderly person might become frail and weak, with even the simplest activities like getting out of bed or walking across the room becoming more difficult. Medical conditions such as cancer, heart disease, or kidney failure can contribute to this weight loss as well. Even mental health conditions, such as depression or memory loss, can cause a person to eat less, leading to a dangerous cycle where the body is not receiving enough nutrition to sustain itself. If you've noticed that your loved one is eating less, struggling with appetite, or feeling weak, it's important to understand that the issue isn't just diet. It's a deeper, more significant change in the body. Rather than forcing large meals or trying to trick them into eating, focus on comfort and simplicity. Offer small, easy-to-eat meals and ensure they stay hydrated. Sometimes, providing soft, comforting foods or protein drinks can help maintain their health. But more importantly, it is about providing care and understanding as their body transitions. 2. Extreme fatigue and weakness. In the final stages of life, fatigue becomes more than just the typical tiredness one might feel after a long day. It becomes a deep, overwhelming exhaustion that doesn't go away with rest. This kind of tiredness affects the ability to perform even the most basic tasks. Getting out of bed may feel impossible. Walking across the room becomes an arduous task. And activities that were once second nature such as cooking, dressing, or even holding a conversation, become exhausting. This is not just normal aging. It's a sign that the body is beginning to conserve its remaining energy. As vital organs begin to slow down, the body redirects its resources to the most essential functions. The heart no longer pumps as strongly, blood circulation weakens, and muscles don't receive the oxygen they need to function properly. This decline in circulation and energy is what causes an elderly person to feel constantly tired, weak, and unsteady. As the body conserves energy, it also slows down metabolism, making it harder to produce the energy needed for regular activity. This is why many elderly people start to sleep more, take longer naps during the day, and find it harder to stay awake or alert for long periods. Sometimes this fatigue can feel like a sudden drop in energy. One minute, they might seem fine, and the next, they are completely drained. This can be emotionally taxing for both the elderly person and their family. The person who once felt independent and energetic may now feel frustrated, isolated, or embarrassed about their limitations. They may withdraw from conversations, avoid social events, or stop doing activities they once enjoyed, not because they no longer care, but because they simply don't have the strength. For family members, it's important to understand that this fatigue isn't something that can be fixed. Pushing your loved one to do more than they are physically capable of will likely cause more harm than good. What matters now is offering them comfort, letting them rest, and helping them find peace in their remaining time. Don't expect them to maintain the same level of activity. Instead, focus on providing a calm, supportive environment and cherish the moments you still have together. 3. Increase confusion or withdrawal. One of the most difficult and heartbreaking changes that happen in the final stages of life is a shift in mental and emotional function. You may notice that your loved one, once sharp and engaged, begins to forget things more often, repeat themselves, or struggle to follow simple conversations. They may become disoriented in familiar places, forget names, or lose track of time. These mental changes often start months or even a year before death, and they are not merely signs of normal aging. They are an indication that the brain, just like the rest of the body, is beginning to deteriorate. As the body begins to shut down, the brain's ability to function is compromised. Blood flow to the brain decreases, and oxygen levels drop, which can cause confusion, difficulty making decisions, and even problems recognizing people and places that were once familiar. This mental decline is often accompanied by periods of lucidity, followed by episodes of confusion, where the person may seem to zone out or forget where they are or who they are speaking with. In addition to cognitive decline, many elderly people also become emotionally withdrawn. They may stop participating in conversations, avoid social events, or spend long periods of time in silence. This is not a reflection of their love for others. It's simply that their brain is no longer processing emotions in the same way it used to. Loud or busy environments may become overwhelming for them, and they might retreat into their own world to find comfort. It can be incredibly painful for family members to watch this happen. The person you've always known may begin to feel like a stranger, and it can feel like you're losing them before they're physically gone. It's important to remember that they are not withdrawing on purpose. Instead of trying to bring them back into conversations, try to meet them where they are. Offer comfort and reassurance, even if they don't respond in the way they used to. Sometimes, simply sitting quietly with them, holding their hand, or speaking softly can provide them with the peace they need. 4. Frequent infections and slow healing. In the final stages of life, the immune system becomes weaker, and infections become more frequent and harder to manage. Your loved one, who may have rarely been sick in the past, may now catch colds, the flu, or other minor infections with greater frequency. These infections may also take much longer to recover from. Small cuts and bruises that once healed quickly might now remain open for weeks or become infected, causing further complications. This occurs because the body's immune defenses are no longer as effective as they once were. As circulation decreases, the body struggles to deliver enough oxygen and nutrients to fight off infections and heal wounds. Conditions like pneumonia, urinary tract infections, and skin infections may become more common and more difficult to treat. Antibiotics may not work as quickly, requiring stronger or more prolonged treatments. One of the most concerning issues in the final year of life is the development of chronic wounds or bed sores. When someone becomes less mobile and spends more time in bed, the skin can become damaged, leading to sores that are slow to heal. These can lead to serious infections if not properly managed. For family members, it can be difficult to watch their loved one go through these recurring infections. It's tempting to push for more medical interventions, hoping that one more round of antibiotics or another hospital stay will solve the problem. However, at this stage, the focus should often shift from curing the illness to providing comfort. Ensuring that your loved one stays hydrated, keeping their skin clean, and reducing the stress on their body can often provide more relief than further treatments. 5. Major changes in breathing or circulation. One of the most obvious physical signs that the body is nearing its final stage is a change in breathing patterns and circulation. As the heart weakens and the body begins to focus on essential organs, blood flow to the extremities decreases. You may notice that your loved one's breathing becomes slower, more shallow, or irregular. They may breathe more deeply for a few moments and then pause, or their breath may alternate between fast and slow in a pattern known as Cheyne-Stokes respiration. In addition to changes in breathing, circulation problems may become evident. Hands, feet, and even the nose or ears may feel cold to the touch, and the skin may appear pale or slightly bluish, especially around the fingertips and toes. This is because the body is redirecting blood to the vital organs, reducing circulation to the extremities. As the body continues to slow down, shortness of breath can become more noticeable, even with small movements. Sitting up, talking, or changing positions might leave your loved one gasping for air. These changes can be frightening for family members, but it's important to remember that they are part of the body's natural process. The goal at this stage is not to fix these changes, but to focus on comfort. Keeping the room cool, using a humidifier to moisten the air, and offering small sips of water can help ease the discomfort of labored breathing. In some cases, medications or oxygen therapy may be helpful, but above all, providing a calm and peaceful environment is key. Final thoughts. As we've seen, significant weight loss, extreme fatigue, confusion, frequent infections, and changes in breathing and circulation are all key signs that someone may be nearing the end of their life. While these signs can be difficult to accept, understanding them allows you to be better prepared, both emotionally and practically, for what lies ahead. The most important thing is to focus on comfort, dignity, and love in the final months. Let go of expectations about what your loved one can do, and instead, focus on cherishing the time you have left together. Make their remaining days as peaceful as possible, providing care, support, and reassurance. Every moment counts. Thank you for watching this video. If you found this content helpful, please like, subscribe, and share it with others who might benefit. Your support helps us continue creating valuable content to inform, inspire, and provide comfort during life's most challenging times. Take care, and we'll see you in the next video.